So we showed that the person with cortical death or cerebral death or vegetative state is unaware of himself and surrounding, unresponsive to any kind of stimuli except the brain stimuli, but the response is different. He shows generalized cluness all over the body. Also, he have no visual tracking to any object in front of his eye. Even the mirror test is he cannot track the image in the mirror in front of him. While a person in brainstem death will have deep irreversible coma with affection of vital center. Here he will have deep irreversible coma. Why? Because he has affection in the brainstem. The brainstem contains the reticular activating system, which is responsible for the awakefulness arousal of the person. When the person loses his arousal, he also will lose his cognition, so he will lose all the consciousness, while a person in cortical state will lose cognition alone. Cognition, which is the awareness alone, can be lost, while arousal is maintained because arousal can be maintained as we see in the previous video. So he is not, the person in vegetative state is not in deep irreversible coma as written in your book. Please correct it. But in case of brainstem death, the person has deep irreversible coma with affection of vital centers, so he cannot breathe or the heart cannot act spontaneously. He need to be connected to ventilator to can breathe and to keep heart beating. The third type is whole brain death. In case of whole brain death, the person will show manifestation similar to that of the brainstem death. He will show deep irreversible coma because the brainstem is also affected or included in the affection or included in the damage. So the reticular activating system is affected, so the arousal is lost, and also cognition will be lost. So consciousness will be lost completely. So he is in deep irreversible coma. Also, his brainstem is affected, so the respiratory center is not working, so he cannot spontaneously breathing, and his heart will not beat spontaneously except after connection to the ventilator. So, what are the causes of brain death? These are the causes written in your book, but we have divided them into three categories. First, the traumatic category. All traumatic causes that lead to brain death or brain damage will be included in the causes of brain death. The traumatic causes include intracranial hemorrhage. Traumatic causes of intracranial hemorrhage. What are the intracranial hemorrhage? The meningeal hemorrhage, which are extradural, subdural, subarachnoid, in addition to the intracerebral hemorrhage. These are the intracranial hemorrhage. Any traumatic cause of intracranial hemorrhage is included in the traumatic causes of brain death. Also, cerebral laceration in case of gunshot injuries. Second is the pathological causes. Again, the pathological causes of intracranial hemorrhage and any other pathological cause, including cerebral tumor, cerebral edema, cerebral ischemia, hydrocephalus, cerebral anoxia, cerebrovascular accident. Any type of these causes will lead to brain death. Third is toxicity. In case of carbon monoxide toxicity or severe CNS depressant toxicity. What will happen? What are the pathological events? As a result of any of the previous causes we mentioned before in the previous slide, the first reaction of the brain is brain swelling. The brain is inside the skull, okay? The skull is hard or soft. Can the skull accommodate the swelling of the brain? Can the skull expand with the swelling of the brain? No, because it's hard. So where does the swollen brain go? It will press on the ventricle inside the brain. the ventricle will collapse. This leads accumulation to the CSF, accumulation of the CSF inside the brain. This leads to increase in intracranial pressure. Before we proceed, I will ask you a question. Why do you think, what is the cause that the blood go from the heart to the cranium against the gravity? What is the cause of this? Yes, there are two causes. First is the pumping action of the heart. The second cause is a difference in the pressure. I mean that there is a difference between the intra-arterial pressure and the intracranial pressure. The intra-arterial pressure is higher than the intracranial pressure, so there is a pressure gradient, so blood will go against the gravity inside the cranium. In our case, in case of pathological event, while the brain is swelling and compressing the ventricles, the intracranial pressure will increase. This increase in the intracranial pressure will proceed until the intracranial pressure is the same as the intra-arterial pressure. At this time, no blood will enter the cranium and the brain cell will die. More increase in the intracranial pressure, there is no space, so the brain will try to find any way to go outside the skull. The largest foramina present in the skull is the foramen magnum in the base of the skull. The brain will push itself through the foramen magnum. The first part will go through foramen magnum is the brainstem. This is known as herniation or conization of the brainstem. This leads to infarction and asphyxia because of the infarction or death of the respiratory. This video will show what I explained in the previous slide. Let's see them.
If a person receives a serious blow to the head, the brain might begin to swell. Since the skull is made of hard bone, it does not allow the brain to expand. Physicians can try medication to reduce the swelling, but if this does not succeed, the pressure in the brain can grow greater than the pressure of the beating heart. Once this happens, the heart can no longer successfully force oxygenated blood to the brain. With no blood supply to the brain, the whole brain dies due to lack of oxygen. In fact, the brain cells don't just die. They begin a process called lysis, where they begin to liquefy. This liquefaction of the brain cells makes brainstem death irreversible. Once the brainstem dies, the person stops breathing, and the heart and the rest of the organs die from oxygen deprivation. The person receives
Uh, here is some question to assess if you understand the lesson. Give the scientific term for the following statement: irreversible cessation of brain and brainstem function. This is the definition of brain death. Yes. The individual is no longer a unit of society, unaware of himself and the world. This is vegetative state, persistent vegetative state, cortical death, cerebral death, or all are synonymous. As regards persistent vegetative state, all of the following are true except the patient loses higher cerebral power, brainstem function are lost, there are spontaneous respiration and cardiac function, It occurs in massive cerebral infarcts. The right answer is brainstem function are lost because they are not lost in case of vegetative state. As regard diagnosis of brain death, we have different steps. The first step is precondition. There is some precondition that should be present in the patient who will be diagnosed as brain death. Next, if the precondition is fulfilled, we will do initial clinical examination, then test for brainstem reflexes, then the confirmatory test. This is like STIR. Precondition is the first step, initial clinical examination, test for brainstem reflexes, and confirmatory test. You should go step by step. You shouldn't jump from step to next step before you fulfill each step to the end. Today we will only discuss the precondition because the next three steps need a specialist. But the precondition is you should know because you can be a GB and you can be acting in a shift in ICU. You have a patient who is connected to the ventilator, and you should know if you are going or the team are going to diagnose brain death. Can he fulfill the criteria or the precondition to be diagnosed as brain death or what are the preconditions? The first precondition is that the person should be in coma, and the cause of coma should be firmly recognized either by CT, MRI, or other investigation. The event that caused brain death, which is the cause of coma, occurs at least 6 hours previously. Precondition that the cause of coma should be we should exclude the reversible causes of coma. What are the reversible causes of coma? Any type of metabolic endocrinal coma is reversible, like liver failure, renal failure, hypothyroidism, hyperglycemia, hypoglycemia. All these causes can be reversed by giving the patient the convenient treatment. Also, hypothermia. If the person has a body temperature of less than 32 degrees centigrade, he will have he will lose all the reflexes, all the body reflexes, so he will appear to be dead. Also, toxicity. The coma caused by or the toxic coma is reversible by giving the person the antidote and by giving him supportive care, enhanced elimination, and decontamination. So we should do drug screen. So the third precondition is to exclude the causes of reversible coma. The last precondition is the patient on a ventilator. He has no spontaneous respiration. So these are the preconditions. What are the preconditions? The person should be in coma. The cause of coma should be firmly recognized by investigation and should occur 6 hours previously. The coma should not be reversible coma, and the person is not spontaneously respirating. He is ventilated. So all brain death patients are in coma, but not all coma patients have brain death. This is right because many persons are in coma, like hepatic coma, renal coma, hypoglycemia. These are reversible coma. We cannot diagnose them as having brain death because if we give them the convenient treatment, they will regain their consciousness and be normal again. But the brain dead person will not regain his consciousness. He is not respirating spontaneously. He is in coma actually, but with irreversible damage in the. What are the precautions that should be taken before certifying brain death? First of all, who will diagnose brain death? Brain death should be diagnosed by three specialists. Three specialists at the same time. All are a committee to diagnose the brain death. What are the specialties that can diagnose brain death? One of the following four specialties: neurosurgery, neuropsychiatry, intensive care medicine, and anesthesia. These are the specialty that can diagnose brain death. Three of any of the four specialty can diagnose brain death. Second, if there are tests that should be diagnosed in the guidelines, we have different steps we didn't mention because they are in the extended part of your curriculum, which are the initial clinical examination, test for brainstem reflexes, and confirmatory test. Sometimes you will find that in the guidelines, but some tests are said to be repeated. So if there is tests that should be repeated, it should be repeated as with the separated interval mentioned in the third. If there is any doubt about diagnosis, you should support the person with the ventilator and not disconnect him, because any doubt means that you are not sure of your diagnosis, so you should keep him alive. If you are sure of your diagnosis and you confirm the diagnosis of brain death, the death certificate will be issued, while any continual ventilation to allow organ donation doesn't constitute life. This means that after confirmation of brain death, you will write the death certificate, and this person will undergo all laws of death, like burial, like to be herited. But if the person or his relatives allow for organ transplantation, sometimes the medical personnel will reconnect the ventilator just to keep the organ viable until organ transplantation is done, not to continue his life, but only to maintain the organ viable. Last precondition is exclude any physician related to potential recipient or transplantation team from those involved in diagnosis of brain death. I have a team for diagnosis of brain death, which is consisted of three specialists. I should exclude any physician who has conflict of interest. What is the meaning of conflict interest? This means that he have special interest for himself, and this interest is conflicting with the interest of his patient. Sometimes the doctor need an organ for organ transplantation for some of his relatives. The physician need organ transplantation for one of his relatives. So if he is included in the diagnosis team of brain death, he can be biased and he can diagnose brain death just to pick an organ for his relative who need organ transplantation. Sometimes the physician need to the physician is included in another team, which is a team of organ transplantation, and so he is biased. He is in a hurry to diagnose brain death, to do the organ transplantation operation, just to take money, to take repetition. This is types of conflict of interest. All these types of conflict of interest should be excluded from the team of diagnosis of brain death. So the precaution, sorry, is the first one, who are involved in the team of diagnosis of brain death. The second is that the test should be repeated by the mentioned interval. Third, if there is any doubt, you should maintain the support of the person. Fourth, if you diagnose brain death, you should write down the death certificate, and any reconnection of the ventilator is just because of the maintaining the organ viable for organ transplantation if this person or his relative allow for organ donation. And last, exclude any physician who has conflict of interest from the team for diagnosis of brain. The last item is conflicts about brain death. The concept of brain death is a matter of international debate. Why? This debate appeared because that the diagnosis is broad. Brain death, actually, as we said in the start of the lecture, that the diagnosis of the definition of brain death is irreversible loss of all function of the brain. Actually, we are interested in the function of the brain stem. Actually, we are interested in the respiratory center. If the person has irreversible damage in the brain stem or in his respiratory center, this is enough to say that he is brain dead, even if there is a function of other area of the brain like the cortical areas or subcortical areas. So sometimes the person has irreversible damage in the brain stem, but he has functioning or still functioning areas in the cortex and subcortex. So this lead to the debate. They said why you are saying that this person is brain dead while he has function of the cortex and some subcortical areas. We said that he is brain dead because his brain stem is irreversibly damaged and his respiratory center is irreversibly damaged, and if he is disconnected from the ventilator he will lose his life within minutes. Okay, so this debate is just debate because of the definition or because of the broad definition we said in the first slides of our lecture. There is sound evidence that many individuals who met the clinical criteria for brain death continue to have some normal subcortical function. Tachycardia and hypertension were elicited during organ harvesting. Hypothalamus, there is thermoregulatory control found in these persons. Pituitary gland function, pregnant woman diagnosed as brain dead continues her pregnancy while on life support system, even producing breast milk, which indicate functioning anterior lobe of pituitary. In addition to the intact autonomic function, there is autonomic reflexes. All these functions are function of the subcortical area, and we are not interested in the function of the cortex or subcortex. We are all only interested in the function of the brainstem. If the brainstem is irreversibly damaged, including the respiratory center, this person is said to have brainstem. There is a test in the diagnosis of brain death is known as apnea test. This apnea test depends on increasing the PCO2 level to the maximum. This is to stimulate the respiratory center to function if it is still functioning. So the person who argue about brain death say that apnea test is a poisonous test. Why? Because it increases the PCO2 level to the highest level. This is a poison to the heart. The blood pressure will drop, and there will be irreversible cessation of blood supply to the brain. So, if the damage is reversible in the brain, it will be irreversible. But actually, the apnea test is the last step in the diagnosis of brain death, and we are diagnosing this. So we are not keen to keep life. We just need to confirm is he dead or living. So we should do the apnea test just to diagnose or to make it clear is the person is dead or living. The third argument is that moderate hypothermia and hypothermia, antibiotics, prevention of arterial hypotension, and occasionally intra-arterial thrombolysis may contribute to good recovery of some cases of brain injury currently regarded as irreversible. And we should say that during the diagnosis of brain death, all these items or all these manipulation or all the treatment of the person should continue even during the diagnosis, because we are trying to save this person. We are trying to keep him alive. We are diagnosing brain death actually, but we are hoping that this diagnosis failed to meet the criteria for brain death, and we hope that this person is alive. So we are continuing treatment during the diagnosis. All these parameters can be done during diagnosis of brain death if they succeed to save the life of this person. It is very good, and we welcome this. Okay. Before we say thank you, I should mention that what is the site of the religion and the law about brain death in different countries. Actually, different religions has different opinions about brain death. Each religion, like Jewish, Christianity and Islam, has some persons who are pro with brain death, and some person who are cons to brain death. Some person support the concept of brain death, and some person who oppose the concept of brain death. But actually مجمع الفقه الإسلامي declared that if the physician who are specialists, and they are committee of 3 physicians who are experienced in these cases, declare that this person is brain death, this is actual death, and they consider this a normal death, and this person should be buried and will undergo all the laws of death. This is the opinion of مجمع الفقه الإسلامي. What about the laws of the countries? It differs from country to another country. In Egypt, there is no law that permit the physician to diagnose a case of brain death. The person on a ventilator who is brain dead, should be kept on the ventilator until his heart stop because of another cause other than the irreversibility of the CNS damage, like any other cause, arrhythmia, sometimes the renal failure, sometimes infection. All these causes can lead to heart stoppage even on the ventilator. And in Egypt, there is no law that support the physician to diagnose a case of brain death. While in Saudi Arabia, years ago, they accept the concept of brain death, and they accept the concept of organ transplantation. So it differs from country to country. You can search on the internet for what about the laws in Malaysia to know what is the laws about the concept of brain death. Is it accepted or refused in your country? I hope this lecture is useful for you. Thank you, and see you again.